Go ahead. Dr. Neighbor.
Good afternoon, everyone, and welcome to this Sunday's edition of Black Health Trust. We are so happy that you have chosen to join us for this exchange of trusted information, and we are going to open it up today for more interactive conversation. I'd like to call your attention when it appears in chat to our disclaimer addressing this programming. I'd like to welcome my co-moderator, Dr. Ivan Walks, and I'm going to turn it over now to our founder, Dr. Randall Maxey.
Good morning and good afternoon, rather. Thank you, Dr. Neighbor Stevens and Dr. Walks. And again, welcome to our guests. And we have no presenters this morning, but I think we're going to have some informing information and fun. We do know that there is major concern about not only the pandemic caused by the coronavirus, but we know that there are also variants that are growing. There's the initial Delta variant. There are several on the horizon, including Lambda. And we know that there are different rates of suggested infectivity. There are also a lot of questions that people have, uncertainties about the vaccines and whether they should take them, whether they shouldn't. We know that there has been some information that has engendered some confusion coming from the CDC, the White House, and the FDA. And we also know that there's a lot of misinformation that's been playing out on social media. Our job on this broadcast is to seek ways to better communicate health information to protect communities of color, not only from COVID, but from the ravages of bad health that result not only from genetics, but also from diseases resulting from poor eating habits, poor health habits. And so in an effort to do a potential course correction or provide better information, we want to make this an open forum. So you are at risk being on this broadcast that we may ask you to give your opinion or ask a question, and it helps us to know what people are thinking. So we have a number of experts that always call in that are physicians and health providers. And we have a number of lay experts and a number of people who simply have interest in protecting their families. So I'd like to start off the program if Dr. Neighbor would simply give us our update on statistics regarding COVID, and then we'll get started. Thank you very much.
All right, we are going to quickly review the information that we took from the CDC website, the CDC COVID-19 tracker data, which, as you know, is updated every evening prior to the next day. And I don't have good news. People are still dying from COVID. We have reached a total of 644,848 deaths. We have had 39,831,318 cases to date. And although they're still sort of scrambling to get the actual data, we do know that more and more children are being infected because it is thought because of the greater ability of COVID-19 to be transmitted among people, added to the fact that children under 12 are not eligible for vaccinations. So we are still in the midst of a very vigorous battle. I don't like to have to say this again, but we are still totally underrepresented in the population in terms of attempting to get the immunizations and achieving the state of full vaccination. As of yesterday, we represented 14.5% of all of the individuals who have attempted to get their first vaccination. And I'm sorry, of people who have initiated their vaccinations. We are 9.8% of all persons who are fully vaccinated in this country. So we are not taking advantage of those things in our disposal, our weapons, if you will, to combat COVID. We're not taking advantage of getting the vaccines. And I'm afraid we're not being as vigorous as we should be around masking, both inside and outside, and safe distancing. So with that, I will turn it back over to Dr. Maxey.
Thank you again. Pay very close attention to these statistics. I have received some information that I want to use to start off the conversation, that there are a number of major issues that affect what's going on with the pandemic, with COVID-19, and with our treatment. The biggest factor found out by a group of economists is that of income inequality. That in the neighborhoods and the parts of states in the United States where there is the largest deficit of people receiving the vaccine and hopefully therefore becoming protected from severe illness, mitigation of hospitalization and death, are those neighborhoods where there is the largest gap, the largest amount of income inequality. That is also true internationally on the global scale, that the countries that are so-called first world countries versus third world countries, they suffer the same income inequality. Following that, what these economic scientists found in their surveys, that there is a lower amount of trust where there is income inequality. And that exactly fits what I believe is happening in our neighborhoods, that when you're making $5 an hour, why would you trust the people at the top income stream? So that seems to be a major cause. Now, I think there's another confounding factor, and I'll reference Mr. Carl Brook. Years ago, when I was the consulting physician for a group that he headed called the Executive Leadership Council, in our health surveys that we did, in our health screenings, we found out that even though these men and women who were at the head spots of Fortune 500 companies, but were Black, they had similar health statistics for health risk as the most economically depressed areas of the Black community. There was no difference. But the common denominator, even more than economics, may be the social heritage, the eating habits, the mores of our society. So why are communities of color more affected by COVID? And I got sent an article by Dr. Nabor Stevens that even with the flu, we have a higher death rate with the flu. We have a higher death rate from high blood pressure, a higher death rate from cardiovascular disease, a higher death rate from congestive heart failure. Why do we win all of these contests that you don't want to be a winner in? And between Dr. Neighbor-Stevens and Dr. Walsh, we want to have a discussion with both the lay audience as well as the professional audience that's on this call as to what we think and how we can be more effective in conveying health information to be more resistant to not only this virus, but the other exigencies of life. How do we stop being more vulnerable? What are the health things that we need to do? When we first started this program, every Sunday, we preached that you should eat healthy, you should eat more of a plant-based diet, that you should eat more green vegetables, that you should probably supplement your health with taking essential vitamins, such that are in the prenatal vitamins, that you should have probiotics, that you should have good amounts of vitamin D3, selenium, and zinc. And we also talked about the social distancing, the use of masks, and then we mostly talked about the vaccine. But given those issues, we'd like some comment from the people on this call. And I'd like you to volunteer, but I'm not above calling on names that I see. Who would like to step in the ring first and give a comment or their opinion? And this is not a punishment. This is an honest discussion that we think can be very helpful to everybody on this call. And I notice a person who's got some diamonds and some jewels, and I'm going to call her first, Miss Tori Bailey. Any thoughts on what we've talked about?
While she's being unmuted, I'd like to throw out a thought also and put it in the stew that we're cooking. Last night, my husband and I were watching 42, the story of Jackie Robinson. I know y'all are saying, now, where is she going with that? In the course of that movie, it was mentioned that he died at the age of 52, which took me a little bit by surprise because, even though it was a movie and it was Chadwick Boseman, he had to have been a pretty athletic person to do the kinds of things that he did in baseball. And yet he died at 52. So that made me curious, and I started researching what happened that made him die at 52. As it turns out, at the age of 37, I think it was, he was diagnosed with diabetes. And subsequent to that, had all of the things, all of the complications that you normally see in individuals with diabetes. And two of his brothers also had diabetes. But then the article went on to talk about his childhood. And it turns out his childhood was riddled with things that we now call ACEs. And we know that, and let me just say, and not to mention what he went through desegregating Major League Baseball.
Define ACE, Dr. Neighbor.
Adverse childhood events. He grew up in South Georgia on the border of Florida. His father was out of the home at his early age. His mother was a single mother raising several children. They had multiple incidents around the town that they lived in. They were one of the few Black families in there. They had multiple incidents where they were had to deal with racial slurs and onslaughts. And it was a generally very difficult, traumatic childhood for him. So we have had a couple of talks, at least, on childhood adverse events, and have discussed before the links that have been demonstrated between adverse childhood events and almost all of the significant conditions you see in adulthood. So I just want to throw that into the stew as well.
Thank you. That was extremely relevant. Is Ms. Bailey unmuted yet?
I am.
We'd love your perspective and comment.
In regards to,
To-
restate the question for me, please.
The issue is, why are communities of color leading the race for death from viruses, death from COVID, death from diabetes, death from high blood pressure, death from cardiovascular disease? And what is it that we need to do? Why is our community so much at risk? What are some of the reasons, and what are some of the approaches we can use to change this negative direction?
Well, I think I'll start with the positive. That
Let me first introduce you as a member of our advisory committee, and we thank you for helping us with Black Health Trust all this time, but go ahead.
Thank you. You're quite welcome. One of my passions. But I think we'll start with the positive. You're doing what you're doing now is opening up, demystifying medicine to the community and allowing people to come into a world that's normally pretty private. The Black community, we can start with, what is it, 70% have not been vaccinated approximately. And it's trust factor is one. Two is fear of the unknown. And then you have, just like I said, people have looked at history and the disservice in healthcare that has been given to the majority of the African American community. And it's time to just get out, get the word out, invite them in, and doing what you're doing. So I just want you to keep up the good work and just keep reaching out to the community to invite them in to understand that there are physicians out there who care. And that's the main thing, is that you reach out, let people be more interactive with the medicine, the world of medicine, shall I say. And that's my perspective so far. But it's the trust factor and the fear of the unknown and the treatment that has been given in the past, and not just in the far past. There are still discrepancies and disparities of treatment when it comes to people of color overall.
Well, thank you very much, Ms. Bailey.
Mhm.
Does
Thank
anybody
you.
else have their hand up in the chat? I'm going to ask another one of our guests that's been on with us almost every time, from the great state of Louisiana. Mr. Herb Darcy, are you on?
Yes, sir.
I'd like your perspective and comment, if you would, and any questions you want to ask.
Well, I think the last commenter hit it on the head. It's a combination of past history and current history. The disparities that we continue to see doesn't give you a warm and fuzzy feeling about trusting everything that you're being told.
And later on, I want you to comment on an item that you have that may be of interest to many on this call. But what would you suggest that we change in our approach from our trusted messengers? What are we possibly missing in our communication?
I think the concept of using trusted messengers, especially that look like the people that you're trying to approach, is a very valid way to go about it. So it's just a matter of continuing along those lines and going to the people where they are and speaking directly to their concerns in terms of questioning, on an individual basis, what the reasoning is of that particular individual, and most importantly, listening to exactly what they have to say and not trying to lump every issue into the same pot, but address those individual concerns, like I said, from that trusted source.
Thank you. Dr. Walks, I'm going to put a statement out there and you might want to comment. Maybe somebody else will jump in. I had a patient earlier this week, new patient. She was a licensed vocational nurse, had worked in hospitals, including LA County Hospital, which means she had the real immersion in Black community medicine. And she said, well, Dr. Max, I heard you on the radio and I heard you talking about vaccines. And what I liked about what you said, you were saying, don't trust the vaccines and we shouldn't take them. I said, that's entirely the opposite of what I was trying to convey. And I don't understand why you converted my words to say I was recommending not taking vaccines. But many times people listen or hear what you say, but maybe they didn't listen. Dr. Walsh, how does that sort of work? And maybe we can increase our discussion around that. How could somebody think that I was saying don't take the vaccine?
Well, Dr. Maxey, sometimes in an effort to be inclusive and in an effort to paint a broad picture, we expect people to pick out what we're really trying to convey. And I will often say to someone, well, I'm not sure what you were saying, but let me tell you what I heard, because that's a way for me to check with that person to make sure that I understood what they were saying. And I think there's a certain amount of trust involved in checking with someone to make sure that you were really hearing them clearly. And a lot of times that's just not, it's just not there. Now, I'm not saying that you were unclear, Dr. Maxey. I've known you a long time, and I can't imagine how somebody would believe that that's not true. All of us can sometimes say things that people, well, it is true that I've known you a long time, and it is true that you're always very clear. But I do think that, sometimes, like back in the beginning of talking to people in public, they would say, when you're writing a speech, tell them what you're going to tell them, then tell them, and then tell them what you told them. Because there's really an important piece of talking to folks that is getting the message across. And sometimes we think we're being as clear as we possibly can, but we don't break it down as much. Sometimes we like to just use those big words and sound important. Sometimes we like to make sure folks know we've read everything and we give them every little aspect of it. But it's not unusual for someone to mishear what you're saying. And one of the reasons is sometimes people are trying to hear something. You know what I mean? They're trying to hear someone say their side. They're trying to hear someone agree with them. And so when you say anything that might almost fit with that, they convert it to what they want. If I haven't taken the vaccine, and I have, but if I haven't taken the vaccine and I'm looking for people who agree with me that the vaccine is not safe, then I'm going to hear any part of what you say and I'm going to take that part. That's just human nature. We all like to be right. We all like to be supported in what we're doing. And nobody is trying to be unsafe. Nobody is trying to get a bad outcome from COVID. So people are really looking for support for the positions that they have. So I think that may explain some of what you heard. But you know what, Dr. Maxey, you actually got someone to come in and talk with you about clarifying something they heard. That's fantastic. That's a wonderful thing.
There's a new word that I learned, and it's called reteaching.
Hmm.
And it's maybe the fourth thing in that tier. Tell them. And what is that thing you said? Tell them what you're going to tell them.
Tell them what you're going to tell them, then tell them what you told them.
And then reteach, have them tell you what they heard.
Okay, I like that.
Yeah. So, and I did that, and I had her draw the same pictures of the coronavirus and the vaccine and how it couldn't infect you with the RNA virus. So by having her repeat back to me, we ended the visit on the same note of accord. So I think making sure they can tell you what you told them verifies that, and that's a very important point.
So Dr. Maxey, before you leave that point, we're talking with a lot of folks who come every Sunday, and we really appreciate them being here. Here, I remember just a little quick story. When I was in medical school, we didn't always go to class. There were many more interesting things to do than go and sit and listen to somebody tell us about their passion. Boy, the immunologist really wanted to tell us about immunology, and the hematologist and every other ologist who studied something and got a PhD in it wanted to come and tell us about it, like if we really wanted to know all the stuff they were saying. The problem is the people who were in class that day, like me, we were already there. So they were trying to tell us about why we should come to class, and we were already in class. And so it was a little bit frustrating. And I don't want us to do the same thing to the folks who are here at the Black Health Trust. The people who are here are the ones who already have an interest. What I would like to hear from the folks, everybody here knows somebody who's not here. And I would really want to hear, how do we get the people who aren't here to come and listen, or how is the message being carried from the folks who are here to other people? There's something in the chat about maybe not enough information about why the vaccine should be taken, not just to protect yourself, but to protect others. And I think that's a very important point. And maybe that's one of the points that we can spend a little bit more time on, is what is it? If people say, well, this is a personal choice, it's just about me. Well, we know it's not just a personal choice about you. And so sometimes, how do we get that kind of information out? Because I appreciate things that people are saying in the chat, because I think it can guide us to be more useful and more effective.
Well, let's follow that train of thought, because this is freewheeling. I think that's excellent. Let's talk about why and why should we get the vaccine? And let's discuss some of the unreadiness around that. Who put that question in? Would they mind stating that question a little bit more succinctly? Would you unmute yourself?
Okay, here I am. I put the question in. I listen to a talk show just about every day, Monday through Friday. And there are many folks that are on there that are requesting information of why it has to be taken. Because if you take the vaccine, there's a chance for you to catch the virus anyway. There's a young lady that's on there on the talk show, and she's a infection protection.
Infectious disease
Yeah.
doctor.
Right. She's a PhD, and what she does is she tries to help people protect themselves from catching other things, other diseases, including COVID. And she does a lot of talking about washing your hands and wearing your mask correctly and all of that, and saying that if you do all of those things plus get the vaccine, then you'll be protected. But what's taken out of her conversation all the time, every day, is just wash your hands and don't worry about the vaccine. So if there's some kind of way that maybe you could even get her on to your program so that she can help to proselytize the vaccine, then maybe that would help. And maybe she could become an advocate and become part of the Black Health Trust.
So let's, if you wouldn't mind putting her name and anything you have on being able to contact her in the chat. But let me ask this, and I want Dr. Neighbor to comment. What I heard, Dr. Walsh, that you said, she said that if you take the vaccine and do all those things that you wouldn't get the infections. But what I do believe was to have been conveyed by taking the vaccine, that it may not prevent you from getting it, but it will mitigate the level of illness or sickness that you get, and will probably protect you from being hospitalized and probably be more of a protection from you dying. But it doesn't necessarily prevent you from getting infected. Am I correct on that, Dr. Neighbor Stephen?
You're correct. You are correct. And I think that I don't know why, but I think we suffer from a tendency in this country to be an all or none kind of thinking, a binary thinking. I don't know where it came from, because for sure we have all had to make compromises and patch things together so that we should know that it's not an all or none. But I suspect, I have no data on this. Let me start off by saying this is what I'm trying to figure out, what I'm seeing happening. And having had some training in marketing, you want to be very careful about how the message that you put in your marketing, because you know that people are only going to pick up on a very small part of the content that you have included in your messaging. And you want the most important thing about whatever your message is to be that part that they take out. And initially, when we were talking about vaccinations and we were having all these people dying, and I won't say people were panicking, but they were certainly distressed by the situation that we found ourselves in. I'm talking about now, last year, Delta just kind of put all of this on steroids. But I think there was the desire on the part of people to have a remedy for the situation. They wanted it fixed. And they didn't want to deal with having to think about any complexity to the fix. And the messaging that came out from both if you listen to it from both government sources as well as the companies, they always talked about 95 to 98%, depending on which product, effectiveness. And as soon as they started saying that, I started asking and wondering, what do you mean by effective? And there, you had to really kind of push to get the definition of effectiveness. And as time went on, there was more comfort, I think, in actually discussing what the vaccines were designed to do and what were reasonable expectations of what the vaccines can do based on the data that was presented. But I think at first, everybody just wanted a fix it now. But what we have come to understand is that at this point, and things may change, I'm optimistic, but especially based on some new information I read today, I am optimistic that we may eventually have a fix. But right now, where we're at is our tools are that we can make any illness that we may come down with as a result of the COVID different variants now and those coming down the pipe, we can make any illness that we get, if we get infected, milder than if we had no vaccine on board at all. So that is what effective means now. It's what it meant then, but I don't think people really understood what our definition of effective really should be around the vaccines at the current state that they're in.
Let me add
So Dr. Maxey, I love Dr. Naybert Stevens, however, let me just be a regular layperson for a minute, because I remember going to get a vaccine in the past. So we sometimes act like COVID-19 vaccine is the only vaccine that's ever been made and it's all brand new. No, it's not. That word is not new, right? So because I'm an old person, I got my shingles vaccine. I am expecting not to get shingles. I'm not expecting to get a mild case. I'm not expecting to keep out of the hospital with shingles. I'm expecting to not get shingles. I got my pneumonia vaccine. I'm expecting to not get that pneumonia. We talk about the HPV vaccine. We're expecting not to get HPV. So I think, in fairness to the rest of the world who are now struggling with breakthrough infections and what have you, I don't remember at the beginning of COVID-19 people being very clear. At least I don't remember them saying, now we're going to give you this vaccine, but we want you to learn something new about the word effectiveness. Am I the only one that is just?
I agree. That's what I was trying to say, that if the messaging was not clear, and I might even push it and say, I thought it was not honest.
That's where I was going. That's why you're one of my favorite doctors, because I think we have to be completely real with people and understand that sometimes we get it wrong. Sometimes the scientists present it wrong, because as a regular layperson, I want you to tell me what I need to know, and don't try to. And I'm not saying you ever do this, Dr. Naybert Stevens, because I never hear you do it, but I hear other doctors try to be right, try to be fancy, and try to act like we've never heard about a vaccine. I heard about vaccines before, and now you're telling me that, oh well, no vaccine prevent. Yes, they do. Other vaccines do different things.
If you took that away, this is a perfect example of what we were talking about before, because you took away from what I said that all vaccines were, that I was very careful to say that in this vaccine, when it was introduced, it was not clear what effective meant. And I can tell you from years of giving immunizations that it is very important to explain what it is that you're doing, why you're giving it, and what your expectations should be. And that is exactly the point that I was trying to make, that was not clearly done.
Let me add on to that.
Perfect.
And I think the word that they were using eventually became efficacious. And they were using the word that these vaccines, one of them was 95% efficacious. And that's good. But what we also need to know is that 5%, there's a 5% non-efficacious, or people who this may not affect in a positive way. And that 5% of a population of almost 400 million people is a huge number that will not be effectively or efficaciously protected by the virus. But what I want to go back to what Ms. Hall said, that she also heard people take away that the virus could be caught by taking the vaccine. We do know that the two current types of vaccines out there are the Pfizer and the Moderna, both of which are so-called mRNA viruses. And what they effectively are is a copy, a computer copy of the head of the coronavirus. And that copy is what is injected into you. It is not a real virus. It is not an attenuated or weaker virus. It is a computer representation of what that looks like. So it cannot possibly give you the virus. It can give you a reaction that is similar to getting the virus, and that produces the antibodies and things that will fight the real virus should you catch it, but you cannot get the real virus from the mRNA vaccines. The J&J vaccine is what we call an adenovirus vaccine. So there is a virus involved, but it is not the coronavirus, it's a carrier, and it cannot give you the coronavirus, but it can produce the antibodies and things that you need to fight the virus. So there are two different types of platforms, but neither one of them can lead to the coronavirus as we know it. So that's another important part of the messaging. Let me go to another person who may want to
There's a
say
hand
something.
up. Dr. Maxey, Ms. Hall has her hand up again.
Go ahead, Ms. Hall. Make sure Ms. Hall is,
Oh, okay. All right, there we go. Okay, I'm a lay person, and I've taken flu vaccine, I've taken pneumonia vaccine, and I've also taken the COVID vaccine. And none of those vaccines that I've taken, I've ever thought that it would prevent me from getting the viruses. So I am a lay person, and most lay people, when they take the vaccines, they're told by the doctor that it's not going to prevent you from getting it. What it's going to do is lessen the severity and you won't get so sick. So I knew that, and I've had the pneumonia vaccine and I got pneumonia, but I wasn't as sick as I was when I didn't have the vaccine. So I will definitely continue to get those vaccines. I think people do carry away from conversations what they want to hear because they don't want to get the COVID vaccine. They're also using now, there's a word going around saying that the CDC is not requiring their employees to even get the vaccines. I don't know if that's true or not, but that's the word that's going around. And that is kind of troublesome because if they're not requiring their employees to get the vaccine, then that sounds to the layperson that doesn't want to believe in the vaccine that it must be dangerous, and that's why they're not doing it.
that's an interesting thing. But let me tell you this, you identify yourself as a layperson. However, this vaccine and this virus has made all of us lay people to a degree because we're finding out new information every day. And I'm the first to admit, and I've done now several hundred of these broadcasts, and I read every day on this virus. And what I say this week gets disproved next month. So we're all lay people, we're all learning. Our job is to bring you the best and vetted information that we have at the time, but we reserve the right, as we know more, to give you the nuances that we think and supported by evidence. We don't claim to know everything, but our job is to provide you with information that you can discuss with your healthcare provider to the best of our ability. And what we are clearly saying, that with the vaccines, the ravages of death have definitely been less, especially in our communities. So we know that to be a fact. Now, we know in the future there may be new and better treatments, but right now, we think that the vaccines recommend are the best that we have right now. But we're clear to say that we have to change our health habits and our eating habits to be better protected. So let's see if somebody else has a comment.
So Dr. Maxey,
I
there's a
just-
comment in the chat from Rhonda Johnson that states most vaccines do not prevent infection. They prevent the clinical disease caused by the infecting pathogen.
Okay, that's
And-
Dr. Rhonda Johnson. Maybe Dr. Sports, we can ask her to unmute.
Do we have Dr. Johnson able to unmute?
Dr. Johnson from the great state of Pennsylvania, the city of Pittsburgh, I believe. Dr. Rhonda Johnson?
He's not unmuted yet.
So while Dr. Johnson is unmuting, let me just put a little bit of nuance in what just happened a few minutes ago. I raised this layperson's comment from my layperson thought about, I'm not supposed to get sick when I get the vaccine. And then we had someone wisely say, no, the vaccine just doesn't make it as bad, which is consistent with what Dr. Nabrit Stevens said. But now Dr. Johnson says that in the chat type that they prevent the clinical disease. So again, there's some nuance in there about what we people should expect when we get a vaccine. And I think there's a lack of clarity sometimes in what people think, because there's a lack of clarity in what they hear. So I just want to put that out there, because I don't think I'm the only one that is sometimes unclear by what I hear. Dr. Johnson.
Hello, good afternoon, everyone. That's one thing I agree with Dr. Maxey. This whole situation has, and I agree with Dr. Maxey most times, it has been so confusing. Never before have I seen a infectious disease where there's so many experts. And you even watch the experts on television and they don't even agree. So particularly on this issue around the third dose, there is a lot of disagreement among the expert community around whether or not these third doses should be given and who should receive them and when and if at all they should be received. But so I understand how there's just so much confusion. But back to what I was asked, and I'm like Barbara, I'm a pediatrician, even though I'm no longer in clinical practice, but for more than 20 some years of my life, I administered immunizations. And I like to liken it to wearing a bulletproof vest. This is how I explain this in lay terms. You have a bulletproof vest on, but the bulletproof vest does not prevent you from taking the bullet. But if you're shot where if that bullet hits you where that bulletproof vest is, you'll survive the bullet. It might knock you over, it might put you down on the ground, but it won't kill you. And that's how I like to explain vaccines. Because, if, again, these are respiratory, in this case, this is a respiratory transmitted virus. Over 90% of people get this primarily through respiratory droplets or aerosolized, virus particles. So if you don't have a mask on and you are in that CDC distance, they say less than 6 feet for the Delta variant. If you're around somebody who has it, if they're talking, singing, sneezing, coughing, and you don't have a mask on and they don't have a mask on, or you have an improperly fitted mask and so do they, well, those virus particles are going to come around you and you will breathe them in. Your nasal mucosa is one of your defense organisms. But again, the antibodies that are in the nasal mucosa are mostly IgA. And after you are a child, you don't have many IgA antibodies. So again, you are going to get infected. That's what that transmission sort of means. I use the equivalency of transmission and infection. So you will get infected. The virus will do some degree of replication. And it's clear for the Delta variant that the virus can do that replication even in fully vaccinated people. That's why the CDC themselves recommend that even fully vaccinated people wear a mask if they are indoors in the public setting, or even if they're outdoors in a public setting with large crowds, because you are susceptible to infection even if you're fully vaccinated. However, if you have functional immunity, now that, again, that's where the nuance comes in, because everybody's immune system is not equally competent. Our immune system is weak when we're born as newborns. The only immunity we have is from our mothers. And it also gets weakened at the other spectrum, the end spectrum of life. And it's strongest when we're children, and any type of disease, that weakens the immune system, or, you can be around environmental pathogens that help weaken your immune system. So the virus can replicate inside your body. But again, if you're vaccinated, you and your immune system has previously responded, you are fully immunized. That's 2 weeks out from any of those doses of the vaccines, all 3 of them. Then you should be able to mount a reasonable response. How long that response lasts is clearly in question. You have different studies saying your antibodies. The CDC recently released a study where they looked at, on August 6th, they published it in the MMWR, talking about natural immunity in a small sample in Kentucky. But then you have the Israelis that looked at antibodies and found that people's antibodies to the Pfizer vaccine, the fully vaccinated weren't as strong as those ones who were unvaccinated. So again, I think it is a confusing situation. You have to really read, you have to study these reports. You have to decide which journals you want to pay attention to. I've made a decision that I'm going to focus on peer-reviewed journals as opposed to these journals that come out in pre-published format where they haven't been reviewed scientifically by peers, but it does get awfully confusing.
Dr. Johnson, there's 2 comments I want you to make. Can
Okay.
you explain and break down a little bit more about IgA so people understand that? And could you also, because you mentioned it, speak to the newborn whose mother has had the vaccine versus not, and how it would affect that newborn's immunity?
Okay, so these are hard things. So I'll start with the IgA, and you may have to remind me what I'm supposed to answer next. But there are different types of immunity. Our bodies have humoral immunity, which has to do with the antibodies that are produced by those antibody producing cells that can live either in the bone marrow or the thymus, or all the organs of the immune system. IgA is called a secretory antibody. It is it predominantly found in the mucous membranes of the nose, and it's a very short-lived kind of antibody. Then there's another antibody that's reproduced in an infection that's typically called IgM. Again, these are early phase antibodies, and the IgG antibodies, which last longer. People do not understand how complicated this is, and I'm not an immunologist, but in response to a pathogen like COVID, the SARS-CoV-2 virus, our bodies can produce 15 to 20 different antibodies that circulate. I like to think of antibodies as sort of soldiers in the army, soldiers in your defense fighting army, because that's what our immune system is. So IgA is an antibody that's not, it's not one of those antibodies that kind of float around in the blood like the IgM or the IgG, but it's a lot of times it's in the nose. There's also an IgE antibody that's associated with a lot of allergic reactions. So again, people should not think that the average layperson, my takeaway message is the average layperson should not consider themselves an immunologist. Immunology is not, it's kind of complicated if you ask me. Okay, so then the question about the newborn and the passage of the antibodies from the mother. Babies get a lot, it takes time for their immune system to work, okay? They are not born, they are born with some part of an immune system because it's their skin and that newborn, that white stuff that covers their bodies when they're born. That helps protect their skin because the skin is a big part of our immune system. It blocks things from getting into our body. So babies are born with a little bit of that, but most of their antibodies they receive from their mothers through the placenta. And then they get an extra boost if their mothers are breastfed. Breastfed, the antibodies come through the breast milk when the mother breastfeeds. It is a very rich source of immunity for newborn babies. I'm oversimplifying this, but the COVID vaccine given to pregnant women has been proven to be safe. And an advantage of getting the vaccine at any stage during pregnancy is that the mother will form antibodies to the COVID virus, the SARS-CoV-2 virus like protein, which help protect the baby. So I hope I answered your questions in kind of lay terms.
Yes, you did. Thank you so much, Dr. Johnson. Our resident pediatrician, Dr. Neighbor Stevens, any comments on Dr. Johnson's you want to add on?
She's the
to?
boss. She's one of my mentors. So anything I say wrong, I defer to her.
It's a beautiful day here in Southern California. It makes me think of the time that I have spent in Jamaica. And we have another knowledgeable physician in Jamaica. And she is also knowledgeable in the fact that what you eat affects your health in general. And I'm wondering if on the side of natural and complementary medicine and dietary things, Dr. Dawes, could you unmute yourself and comment on some of the things we've discussed about the eating habits in Jamaica, but also some of the challenges that you have with vaccines over there?
Okay. Thanks for having me, guys. I'm going to leave shortly because as you can, I'm turned down, but I have another meeting on COVID, actually COVID treatments going on. As we know, we're having our third surge. We actually, a few of the hospitals ran out of oxygen last week. We are pretty much in terms of COVID patients over capacity, probably over 150%. I think one of the things that's pushed everybody getting vaccines, and I get many calls per day. In fact, I turned off my phone yesterday just not to answer that many. Is that we tell people now, yes, maybe the vaccines may not be the best ones that you want. We have JJ, Pfizer, Moderna. But at this point, with the surge that we have, we cannot treat you. We don't have the staff to treat you. Most of our staff are on every other night. This is your best way of surviving. So we have had a number of big companies now jumping on board and pushing that with their workers, as well as just the regular people believing that. They may not believe that the vaccine is the best and won't harm them down the road. And we don't even, I mean, people ask me that and I actually say, I don't know what we'll say 2 or 3 years from now. I know about the Pfizer giving the third shot. And I said, I have friends in the US who have already had it and people are not really happy at that. But presently with this surge, and we are out of a lot of treatments, I will get to what we're using naturally, which also has other things in mind. But right now we have no Tocilizumab in the island. We have none of the other high expensive drugs to treat. We are completely out. As of this morning, I got 2 texts on it. I am infection control for my region, and I start by covering, which is why I have to go to the wards again tomorrow, the isolation wards. So what we're using naturally, we use turmeric and black pepper. I am open because I'm writing a new protocol for the wards. We use a lot of, I don't know, we use Leaf of Life too. You may not know what that is. We also use a lot of steaming, which is used naturally. We use menthol. There are some people that there are other herbs that we use in steaming. I don't know if you guys know fever grass tea or lemongrass tea, but it has natural salicylates on it. And some people are saying if you drink it and you breathe it, the people seem to be doing better doing that. Interesting thing, we use the vitamin C, the vitamin D3, as you also, we use the N-acetyl cysteine, which is also recommended. We use some plants that are known to have vitamin C as well, and antioxidants. As I said, I mentioned Leaf of Life. The other thing that we're using here, and actually we are trying to do a retrospective look, is a lot of the private doctors are using cannabis. And what was noted on our wards in a lot of the psyche patients that came in, which were swabbed, they came in with change in mental status. Their COVID status came back positive, but all were asymptomatic except for change in mental status, which could have been the cannabis or that has done it, or it was protecting it from the COVID. We don't know. In looking on our wards, we're looking at what, besides the obesity and the diabetes, we haven't found hypertension actually seeming to worsen that many people here. But we have not found in the preliminary anybody yet on our wards that we have had to admit to the isolation ward, which is sicker. We treat regular COVID in cubicles on our regular wards because there are so many. But presently, there may be something for CBD we don't know. We're actually looking at it. There are certain poor areas of the reason this comes up, and there are certain poor areas of the island who people don't mask, they're having parties, and we want to know why. Our biggest surge happened recently because of what we call was Dream Weekend, which was a big international series of parties that occurred on the North Coast over the weekend with mostly middle upper class and foreigners. And that's what actually is causing our surge. But we use a lot of fruits, a lot of vegetables. Of course, we use the zinc. We use melatonin to a certain extent at night. Not as common in the hospital. In fact, right now I'm trying to have none of these are on the hospital drug list. So we have to have the families buy it, which means none of the social cases are getting it, which I'm trying to address. And to figure out a way of coming up with those simple things, some simple of the recommended vitamins and herbs. We use the Clexi and everything else that you do normally. But we are in trouble because we're out of everything and everybody now is quite broke and a lot of people are not buying it. So our surge has been bad. Our staff is quite tired. I talked to one of my residents. He said he has been on call every other night for several months.
Well, so first of all, I appreciate you taking your time to speak to us. We try to speak almost every week, and we go from a situation here where people are getting their third dose to Jamaica, where they don't even have access to the vaccines at all. And I'm wondering if in the near future, Dr. Dawes, you could put in the chat and maybe even send us some of your protocols. Dr. Dawes is one of our most respected doctors, even though she's in Jamaica now, but she was educated at Harvard, a nice, very little medical school on the East Coast, and is very well versed in cardiovascular medicine as well as infectious disease. So she's been a great resource for us. So thank you very much, Dr. Dawes.
Dr. Maxey, I forgot to mention, we also use ivermectin, which right now, especially since the US has come out against it in terms of being the horse medicine or whatever. The problem is ivermectin for animals are in very high dosages. Ivermectin in general will not cause side effects unless you take very, very high dosages. Because it's a liquid and given in also animals. It's the same thing we always use in the hospital because it's cheap for animals, so that we treat maggot, worm, river blindness in other places. We have always used that same liquid one. Is that we dose it in maybe a milliliter, which is a lot of people may get, or 2 milliliters, depending on what's going on.
Yeah, maybe we can have an expanded discussion on one of our medical advisory meetings, because there are reports of a number of people that have been taking doses, probably at the level of large animals, and there've
Right,
been
which is
some
bad.
side effects and deaths. So we should hash that out more on our medical advisory call. Thank you so much.
Thank you for having me, and I will go.
Okay,
Thank you. To another meeting, yes.
good. So we depend very much on our psychiatrists for these calls. I know I'm going to call on Dr. Bailey and Dr. Walks again, but there's a gentleman here that's one of the associates of one of our national treasurers, who was a great assistant to Dr. Martin Luther King, who we've been praying for. We understand he and his wife have been ill. But I'd like to ask Mr. William Dickerson, if he is on, to comment on how we can better message some of our information about better living, better health, and COVID. Mr. Dickerson, are you on and able to unmute yourself?
Yes, I am, Dr. Maxey. As you know, our friend has Parkinson's disease, and he has been totally vaccinated, but his wife had not been vaccinated at all. And of course, with him socializing with his wife, he came down with COVID, and he was in the hospital for about 2 weeks, and then he went to rehab. She just got out of the hospital a couple of days ago, and the family has been keeping her pretty much quiet. But I look back at the vaccinations, and needless to say, my wife and I took both shots, and we're planning to take the third one if it comes out. But just looking at where we are today, and making sure that that we're coronavirus is and Delta virus. Needless to say, Delta has crippled all of us, and we definitely try to stay on top of this, and I know that Reverend Jackson is on board with the vaccinations, and I think that his wife will comply with the rules. Both of us, all of us, listen to the scientists and making sure that we have at least protected ourselves.
Thank you very much, Mr. Dickerson. We appreciate it, and our prayers continue for Reverend Jackson. And we appreciate you being on. I think before I turn it over for Dr. Comments from Dr. Neighbor Stevens, I think I see one of the most prominent kidney doctors in Florida. Is that Dr. Dolly Green that's on? Professor of Medicine at University of Miami.
Hello.
Hello.
Hi, this is Dr. Dolly Green's son, Courtney Green.
Okay. How are you?
I'm good. How are you?
Well, we still invite your comments. How's your mom?
Oh yeah, I can said what
I said, how is Dr.
you're
Dollar
breaking
doing?
up.
How is your mom?
Oh, she's doing well. She's doing well. We're doing well. Um, yeah, just a busy week, but we're just staying home and resting.
Okay. Do you have any comments on what our discussion is?
I was just wondering, like, do you think do you think like, and I don't want to like, you know, do you think like this like the vaccine and everything, like do you think it has to do with like politics, like do you like with like past history, like black history, and like the government and CDC, like do you think it has to like anything, or is there, do you understand what I'm saying? Like,
Do I think that the vaccine hesitancy among our community is because of government mistrust? Is that sort of the gist of your question?
yes.
Dr. Neighbor Stevens, would you comment? Or any of our other people on the call? This is an open mic.
Let me ask Dr. Maxey. It seemed like the question was more, was there some political maneuvering involved in
Yeah.
the actual vaccine
I
being
mean,
developed?
yeah.
Okay.
Because at first I was hesitant. I just turned 25. I've never smoked, I've never drank alcohol in my life. I'm a bodybuilder, and I was like very hesitant, and I'm a young black man, so I was very hesitant of taking just taking a vaccine, because I trusted my own immune system. So yeah, I just felt like, yeah, you can go on and talk. Like, do you think there is some sort of maneuvering that's involved? Because when I got the Moderna, I got the Pfizer vaccine, and then I like right after I learned that the CDC has a record of when you're vaccinated, and I just thought that's pretty odd to me, because you know that's just pretty odd.
Okay. So I think I understand what you're saying, and I'll comment, and I'll ask my co-moderators or anybody else to comment on. And we also have a new department head at the University of Louisiana State, I think, on the phone, and also
LSU.
LSU. All right. But there are many questions about, is the government in league with Big Pharma, which is a big pharmaceutical company, or does Dr. Fauci and some of the other prominent people, are they putting the vaccines out there so they can make more money? And do they have a portfolio? And we've heard all of those. And the way I'm going to answer that is that we have something called cardiopulmonary resuscitation, or when somebody has a cardiac arrest. And there are 3 letters that we use. It's called ABC. The first one calls out the airways, that if somebody has a cardiac arrest or passes out, that you want to first restore their ability to breathe, because we know the brain cannot survive very long without oxygen. So the first thing you make sure is to establish an airway for that person. B stands for bleeding. If that person is bleeding, after you establish the airway, you then want to deal with stopping any bleeding.
Were you able to do it, Courtney? Yeah.
So because bleeding can kill you over time, but not as fast as lack of oxygen. And C, I'm just going to label that right now, causation. We want to find out what's the cause of this person passing out. That is not correct, but, and I say that right now we know that the vaccine is mitigating people getting severely ill, mitigating their being hospitalized, and mitigating them dying. I do think that your question is very legitimate, that we need to unravel all this stuff, who owns what, what's their motivation. But if you're not around to be alive, you won't be a part of that discussion. And right now we're trying to save lives. And it's very convincing that the vaccines help prevent people from getting severely ill and dying. And that is our major motivation. Now, are vaccines the ultimate? Are they the end game? I don't know. But in order for me to save a patient's life, I got to first make sure he's got oxygen. Then I got to make sure he's not bleeding out. And then later we'll figure out why they have the cardiac arrest in the first place, which is diagnostic. So I think your questions are extremely relevant, and hopefully we will get more to them. But right now, I think our major goal is to save lives. And I don't know if my co-moderators or other people want to comment on my analogy of the vaccines that I think the gentleman was asking. And by the way, his mom is one of the first full professors of medicine that I met, as African-American at the University of Miami. So he's the son of a famous kidney doctor and a cardiologist. So you got good genes, my friend.
So Dr. Maxey, I'll comment. And first of all, young man, thank you for your question, because it indicates clearly that those kinds of questions are still out there. No matter how much we talk about Dr. Kizzmekia-Corbett being involved in developing the vaccine, no matter how many times we talk about how many hundreds of millions of people have gotten vaccinated, including the young man that asked the question, which I think is very cool, that he went ahead and got his vaccine, even though he does have some questions. I think there's so much out there, and we've talked about this before. There's so much out there. Early on in today's broadcast, there was a comment made that there was a text that the CDC employees were not required to be vaccinated. And if that's true, that's very concerning. And it was left out there like that. That kind of thing concerns me, because that's something that's easy to check. So I just checked over the course of the meeting, trying to multitask, which is not my strong suit. And it turns out there was a viral text with misinformation that went out, but there is a vaccine mandate, mask vaccines or testing and all that, the same kind of federal mandate at the CDC. So when we read things online, the tendency is that we don't do that kind of research. And I think I see something from Dr. Rhonda Johnson that's in the text that looks like it's around that same issue about whether or not the CDC is mandating the vaccine for their employees.
So the CDC has mandated the vaccine and masks, Dr. Wilkes?
That's what I'm finding. And in particular, I found that particular text that was mentioned earlier was a text that went viral with misinformation, with misquotes from people like Dr. Fauci and Dr. Marks and Dr. Walensky. So the problem we have with so much information being online from so many people is that it's hard to find what's actually accurate and verified and what just went viral because somebody wanted to get more likes or more subscriptions or more whatever. It's a difficult time, and it takes me back to this young man's question, Dr. Green's son's question. And I'm sorry, I don't know your name, sir. I would use your name, but I know you're Dr. Green's son. Courtney? Okay. It takes me really, thank you. I really want to respect you, brother. It takes me back to Courtney's question. It's valid that there is still so much concern out there about what's true, what's accurate, who's involved, because we have so many different sources of information. And it's so hard to sort out what's true and what's just viral. So Courtney, young brother, I appreciate you getting vaccinated. I think one of the things we have not gotten to today is the fact that your vaccination status doesn't just protect you, it helps other people around you. We haven't talked a lot about that, but it's really important that we make that point one of the points we focus on. That's what I got, Dr. Maxey.
Thank you. Dr. Neighbor-Stephen?
Barbara, you're on mute. Oh, can't get off.
Can we unmute her? We can't afford her to be unmuted. We'll catch hell later.
When I got the vaccine, and I've never had a cough for this long. I couldn't stop coughing for like a month. And that just really worried me. I just wanted to comment on that. I just wanted to make a comment.
Okay. Well, thank you. I've got a little thing I'm going to say because of who your parents are. Mm-hmm. And that is years ago, there was no profession of kidney specialists. There were no kidney doctors until the 40s. And so they took the very smartest cardiologists and they chose them to be the kidney specialists, the nephrologists. So you come from a good background. Let me ask a question of two of our other attendees. If Dr. Ron Bailey and Dr. Gary Dennis are on. Dr. Ron Bailey is a psychiatrist, as is Dr. Walks. He's a professor and department head at LSU. So he's in the teeth of the tiger down there with the hurricane. Dr. Gary Dennis is a neurosurgeon, and I always comment that he was chief of neurosurgery at age 30, and usually most people are 50 before they get there. So I still don't know how he accomplished that. But one of my concerns with COVID is that people who have clinical disease and even subclinical disease end up having post-acute syndrome with COVID, meaning that their cognitive abilities may be diminished after having been infected with COVID. And in fact, Black Health Trust co-sponsored the first international conference on post-acute syndrome known as long haul syndrome. And I'm wondering if Dr. Bailey would have any comments around that, as well as what we've been talking about today, and then followed by Dr. Gary Dennis.
I'll follow Dr. Bailey.
Go ahead, Dr. Bailey.
I'll let Dr. Dennis go first. I'm actually trying to switch to a laptop. I'm having trouble with the audio on my cell phone.
Okay.
Dr. Dennis?
Dr. Dennis? Yes. Can you hear me?
Yes, sir.
Well, this problem that is protracted illness after viruses is not uncommon. But what you see with COVID is a lot of what we call brain fog and confusion that lasts for quite a while. And sometimes people think that they are coming down with a relapse of COVID, which means that it does require some follow-up and investigation. But usually over a period of 4 to 6 weeks, it continues to improve. Now, the confusion and so-called brain fog that occurs is probably related to changes in blood flow and oxygenation. And the oxygen could be just coming from something like an extensive lung infection, or it could be coming from the brain itself being hypoxic. We don't really have all the answers to that. But what we will do is come around with some interesting conversations between now and whenever we discover what really we need to do. I wonder, is Dr. Bailey, did he succeed?
Yeah, I mean, I apologize. I'm having a hard time with my audio. Can you hear me okay, Dr. Maxey, or should I?
Yeah.
I'm trying to switch to a laptop.
No, we can hear you fine now.
Okay, we'll go. Well, I'll be very brief. You know, I clearly think that the cognitive issues are real. A lot written in the psychiatric literature now about this post-COVID and even pre-COVID syndrome. Persons begin to have the same forms of cognitive impairment that you might have if you have any evidence, I think, of affective illness. So COVID has a pre-existing almost construct of in persons with executive function decline, trouble with concentration, memory, and attention, following and completing tasks, which is one reason why they begin to slow down. And as they slow down cognitively, then I think what follows very often are actual impairments, I think medically, or cardiovascular, respiratory, immune system, and otherwise. I think another thing we actually are seeing is persons who already have pre-existing psychotic illness. This just recently, more in the literature now about an exacerbation of such. So it actually is worse on our patients with chronic mental illness as well. Clearly, we've seen a heightened, one of the highest numbers of percentage of suicide occurred in 2020, and that was coincident with the COVID-19 pandemic. So all three issues, I think, are of great worry and concern to psychiatrists and mental health professionals. High rates of suicide that are probably comorbid or co-occurring with COVID-19, increased rates of early onset of cognitive impairment, the traditional types of executive function difficulty that makes it hard to function, to think, to work, to complete tasks, and an exacerbation of the more severe forms of bipolar and psychotic forms of illness. So it's really a triple whammy for us. It has really done a number, I think, on psychiatry, and it's very hard for us to manage psychiatric sequela with our typical meds. We really need people to take the vaccine to prevent the onslaught of full syndrome of COVID-19.
Well, thank you very much. Let's get a few non-physicians in on this discussion. Ms. Mentors, are you there? Ms. Mentor, Linda Mentor? We'd love to hear from you. Is she able to unmute?
Yes, I am. And I'm sorry, I missed part of it, but I am just a person who was blessed to receive the text in regards to the fact that you are having this. I am not a doctor. I am a senior citizen who has always looked at things just a little differently. So I'm probably one of the people that may make you all think, but I'm in my 70s. So that gives you an idea of the era that I was born in. And yes, I question a few things. I know you were talking about previous vaccines, but I never took the pneumonia vaccine. I never took the flu vaccine because people who would take it would actually get it. And I thought, well, that doesn't make logical sense. And I'm one of those people that try to look at logic. You started out talking about Jackie Robinson and the diabetes, and all I can think about is the fact that people of color, you know, we've not always had the best stores in our neighborhood. But I know when I was younger, we had supermarkets, and we had fresh foods, and the foods were different, and they're not bombarded with all these herbicides and pesticides and all this other garbage that's not good for us.
Where are you from, Ms. Mentors?
I am unfortunately from Indiana.
Okay.
And I say that because Indiana is so backwards to me.
You said Indiana.
Yes, and I consider us a cousin, or if not a twin sister, to Mississippi. And please don't ask why I say that, but trust me, I do. Every Black History Month, when you see those 3 hanging Black men, that was here in Indiana. That's why I say that. But you talk about these diseases, and all I can think of is the fact that nowadays everything is increased, not only because of high fructose corn syrup, but because Black people have always had gardens. Because we want to eat fresh vegetables. Well, what good does it do if, in fact, the ground is contaminated? And in the neighborhood that I'm in, back in the early 70s, long before I ever moved over here, there was a steel mill that blew up. It contaminated our neighborhood. And so now a lot of people developed whether cancer or woke. So when you talk about, even with this virus, I mean, it's still a virus. And all I can think of is, and I know you probably didn't want to get that, but that's why I never say a lot of things because you'll get everything that's inside of me because it's bottled up. But if in fact they had the flu virus in 1918 and they didn't have any vaccines, we still get the flu in 2021. This is still a virus, and I don't see a virus changing because viruses are still viruses, even though they can take on different mutations or whatever the correct wording is. So I've said a lot and you probably are confused because so am I.
No, first of all, thank you so much for your comments. And by the way, I'm at a backward state right next to Indiana. I'm from Ohio. So we're equally as backward or more. That's why I'm in California now. But did Dr. Neighbor-Stevens get unmuted yet, Dr. Ivan?
Yes, she is.
Yes, I am.
Might you comment on Ms. Mentor's comment about the flu vaccines and the flu, does it mutate, and why do we get a vaccine every year? Is it the same, or what are some of the thoughts that we can answer about her comments?
Well, keeping it very at a very high level, let me say, first of all, thank you for your comments, not on the day, but Ms. Mentor, I see your comments every week in the chat. When we talk about viruses, we're talking about in different entities. And as our resident virologist has taught us, the different viruses, the nature of a virus is to change and to survive. And so we have not had the desire to eliminate the existence. Well, let me not say that. Perhaps some people have had the desire to eliminate the existence of viruses, all viruses, or whatever viruses may be causing havoc at a given point of time. But what we have really successfully done through the years is manage the illnesses that those different viruses create. And as viruses do what they do, which is to mutate, it requires the development or modification of the different tools, i.e. vaccines, that we have had that have been developed. So I don't anticipate anytime soon or ever that we won't have viruses in our life. And, you know, we might even want to flip it and say we're in the virus's life. But we will continue to figure out ways to manage it so that we can live together in this universe.
Thank you, Doctor. I want to recognize a few more names unless somebody is in the chat. I see who is DT Evans. Appreciate you unmuting and commenting on the discussion.
Who is who?
DT Evans.
No, see, that's not.
Can you unmute yourself? Then I see Michael Young.
Just a minute, Clay.
I want everybody to feel welcome to have their say, make a statement, ask a question. Who is Ashira? We have a lot of bashful people, huh? Brenda Ager. Can we unmute Ms. Ager? What about M.A.
There you go.
Warford?
Ms. Akers unmuted.
Okay, Ms. Ager, how are you?
I'm great. What you want to know?
We want your comment. We've been talking about the vaccine, good health, and why some people don't want to get the vaccine, or what some of the reasons are, and how can we improve our messaging
Well, you know,
to put safety in our communities?
I talk to people all the time. If you ask me, I'm going to tell you. I'm like that young lady. who's also a young 70, you know. But when and I tell this to young people or whomever, I mean, I saw some people in the grocery line not too long ago, and they were talking about, I'm not taking that freaking vaccine, Barbara. And I just, you know, young lady, can I just say something to you? And without her taking my head off. And I said, I want to just tell you a story of when I was 6 years old. When I was 6 years old, I was living in Lower Peachtree, Alabama, on a cotton farm. And in the first grade, and two of my best friends were in wheelchairs because they had polio. They were crippled, they couldn't walk, and one of them actually died. So the next thing I know, that the whole little school was surrounded in the little church where we went to school, lined up to take a polio shot. And we didn't ask what was in it. We had to take it. But we wiped out polio. So I said, if we can wipe out polio, this is a virus. It's like any other, it's a strong one. But I don't think viruses come to just wipe us out. That we have beautiful, wonderful scientists. And the scientists, you know, God's hand is everywhere. It's got to be in the scientists. It's got to be in the doctors. It's got to be in the singers. It's everywhere. So if it's everywhere present, then that means that some of us are meant to live and be the light for other people. And for people who don't believe in the shot, you know, my brother, God bless him, he took his second shot just yesterday. But he was saying, Shawty, I just don't believe in the shot. And you know, I'm afraid of shots. Some people are just downright afraid to have a needle stuck in their arm. But I'm here to tell you, it doesn't even hurt. And I have felt great since I've taken the first shot, the second shot. And if they call me to take the booster, I'm gonna be the first in line because I believe in science. I believe that the universe works through, and the only way the universe can work is through us. So I think we have to lift up to a higher realm of understanding and know that God is for us and not out to kill us. That old adage, God will smite you dead and God will do that. There's no such God that will do that. If God is love, how can it be anything other than that? So that's my take on this. Now, you know, I will talk a whole hour if you don't start me. So cut me off right now.
We'll cut you off for now, but we're going to hear from you in just a minute because we're moving towards the top of the hour. Thank you so much. Mr. Carl Brooks, are you on? Can Mr. Brooks be unmuted?
I see Mr. Brooks's camera, but I don't see him in front of it. Oh, there he is.
Mr. Brooks, we'd appreciate you joining the discussion. Do you have any comments or thoughts?
I think it's a wonderful discussion. I think for you to open it up and let people give their views, Dr. Walks, Dr. Sherrod, I think everybody is contributing. It's actually adding to the information that we know about all that's going on, and it's wonderful.
Wonderful.
Very good. You mentioned, is Dr. Sherrod on?
I saw her name earlier.
Okay, is Dr.
I see her. I see her still if we can unmute her.
Unmute. Oh, good afternoon.
There she is.
Hello, Dr. Jessie Sherrod, who's been my friend since I was a freshman medical student. She's from Harvard University, a pediatrician, infectious disease epidemiologist, and one of the founders of the Association of Black Women Physicians. Dr. Sherrod, we'd appreciate some of your opinions as we start to close out.
Oh, thank you, Dr. Maxey. And I just want to extend my apologies for not being able to respond last week. I was actually ill and I had a sore throat and a fever. And of course, you know, I thought I had COVID. So I took my 12 milligrams of ivermectin and the next morning I was afebrile, but I went and got tested and I tested negative. But there are several points I'd like to make here, and it goes back a few weeks. One statement that Dr. Neighbor-Stevens made, and I think she wanted that to be very clear, and that is that the vaccine does not prevent transfer of the organism. No. And I think that point was made very clearly. It does not prevent transfer of the virus. So what I want to emphasize, there are several things I want to emphasize, is that there's data out there now showing that people who are vaccinated also get colonized with the virus about equal as much as people who are unvaccinated. And there's data from Tel Aviv now looking at healthcare workers showing that the colonization, the viral load in the nose of healthcare workers was 251 times higher than those who were vaccinated than those who were unvaccinated. So when we say to our parents, get vaccinated so that you can protect your kids, I have some questions about whether that really happens. And my thing is this: I am not anti-vax. I think the vaccine is one great tool we have in our arsenal, but I don't think we're utilizing everything that we could possibly do to mitigate death and save lives, especially in those communities with high rates of hesitancy, and that includes the Black community. Now, I want to go back and I need to clarify, Dr. Maxey, I don't want to say anything that goes against the theme of the Black Health Trust, but I have to talk about ivermectin, because ivermectin, I have here in my hand the Handbook of Antimicrobial Therapy, which is the book which lists all medications that are utilized in humans. And humans have been using ivermectin for over 100 years. The dose is 0.2 milligrams per kilogram, so you can even give it to kids. And it's written as an antiparasitic drug. It has been demonstrated by a group of physicians, pulmonary specialists in Virginia called the WWFLCCC, that it has antiviral effects and it has actually saved lives. So my wish for the Black Health Trust is that we continue to encourage people to get vaccinated. But in the meantime, what can we do for those people who are still on the line to try to save their lives? And one of the tools that has been underutilized is early treatment. Just like I thought I had COVID when I got a fever and a sore throat, you have to treat early. You can prevent going on to severe disease. You can prevent going on to long COVID. And I want to commend Dr. Bailey for outlining so clearly what long COVID is all about, because you know what? It's been around for a long time. It's a post-viral syndrome. It's called chronic fatigue immune dysfunction syndrome, which most physicians ignore, don't know how to treat, and that's a whole nother long story. But
May I ask you two questions?
Okay, ask me a question.
Two. First of all, I do support, and I think the Black Health Trust supports using all forms of potential treatment for our communities. But we decided early on that what we would present to our public is that we would present the information based upon vetted, peer-reviewed, generally accepted information. And things like ivermectin, which all of us know about, haven't reached that level of acceptance yet, and we're hesitant to present it. For example, I'm a strong Christian, and I believe in faith healing, but I don't present that on the Black Health Trust because of the direction that we decided to follow, the NMA, and vetted scientific information. But we continue to open our health provider discussions on Wednesday. We're going to have one this Wednesday that will deal with those issues. So that's why we have not put much on about ivermectin per se, that it has not reached the level of acceptance in the major medical community, et cetera. So, but I have actually given it myself to a couple of patients. I don't personally believe it's of value, but it still remains open in interest. And also, you'd be interested to know I'm having breakfast tomorrow morning with a gentleman that you introduced me to named Dr. Kokai. So we're meeting for brunch tomorrow. He and I had an hour and a half conversation early today, thanks to you, Dr. Surratt. But we have a few more minutes left.
May I just finish, Dr. Maxey? I understand exactly what you're saying. And what I'm saying is that we know that our community is different. We know that we have to reach out differently to them. So what I'm saying, I'm not saying go and do something crazy or, or something that's going to hurt people. But, there are reports of thousands of patients. There's a Dr. Karras in Arkansas. He's given ivermectin to thousands of patients in the jail. No side effect. Nobody has died from ivermectin. And you talk about, the media is pushing that it's a horse drug. I mean, it's in the antimicrobial therapy book. See, that kind of stuff is what I'm talking about. But what I would suggest too is that patients need to know that when they get symptoms, they assume that it's COVID. They go get tested and they need to be treated right then. The doctors are still sending patients home, telling them to wait until you can't breathe and then come into the hospital. And the other thing is the healthcare system is breaking down. That's because the hospitals are burning out. We cannot continue in this mode. So you got to interfere with transmission early on and treatment early on in order to decrease that pipeline into the hospital. Because
I agree with
in
that.
Mississippi, they had hospitals.
Dr. Scruggs, that's what we can't have a long discussion right now.
Yeah,
We're almost
exactly.
at the top of
But
the hour.
thank you so much for allowing me to say that. And, my ultimate respect, but I just have a major problem with the whole approach to mitigating this pandemic in the United States, because there are
I'm
other
gonna
countries
invite you on the Wednesday call at 5:30.
have mitigated
We
the
can have this.
pandemic.
I've only got,
Rwanda has
Dr.
mitigated
Scruggs,
the
I've only got a few more minutes. I want to get back to the point that we're glad that we had this discussion. For next week, we've got a congressman. You want to mention him, Dr. Walks, who we have coming to speak about health policy?
Yes, Dr. Maxey, happy to do that. We here on the Black Health Trust, we really want to take an expansive view of the things that impact the health in our communities. And so next week, we're going to have Congressman Anthony Brown come on. He's a congressman from the state of Maryland that has been very active in health concerns and health policy issues for many, many years. And we're excited to have him come and share with us from that perspective of being a policy maker at the national level.
Okay, and Dr. Barbara Neighbor-Stevens, we have another speaker for next Sunday.
Dr. Neighbor-Stevens is muted again.
Well, we have Dr. William King, who is an MD as well as a JD, a lawyer, and he specializes in infectious diseases. He's going to speak about HIV, and he's also going to speak about STDs, sexually transmitted diseases. And we look forward to having that discussion. And I think we'll also open the mic for at least a period of the time. I want to close out with one saying that we do appreciate the many people who have supported us. We ask that you can donate to help us continue to carry out our message. And we know that there are several individuals that we're going to have present at our Wednesday night medical advisory conference, including Mr. Herb Dorsey. And we have a group called Instamed. And we have another group that has a product called L-arginine, because we think that the COVID is a disease that affects the endometrium. And we want to present that. We also know that many people have been afraid to go to the doctor because of exposure. And I want to end with presenting a brief video on something that we're partnering with that can possibly help. Is Yukini, can you show that video very quickly before we ask Ms. Ager to come on?
Sometimes going to the doctor can be a scary thing, especially if it's been a while. Often in senior patients, readings can be normal at home and high at the doctor's office due to anxiety. That is where InstaMD comes in. InstaMD has an RPM solution designed for senior patients. There are no more erroneous readings as patients are able to calmly check their blood pressure and so much more in the comfort of their homes.
Reading completed and it is normal. Please power off blood pressure cuff.
Now doctors are able to monitor their patients efficiently and daily for better management, making patients become more involved and responsible. The doctor and patients are easily connected, even during a pandemic, with seamless audio and video conferencing. This is a win-win for both parties. SmartHub speaks multiple languages
Lectura finalizada. Parámetros fuera de lo normal.
and auto-connects to commonly used blood pressure monitors, pulse oximeters, scales, glucometers, and much more. With more available data and clear communication, the doctor and patient can understand each other more efficiently. What does that mean for you and your practice? Your practice benefits with better patient care, patient commitment, and increased income, with Medicare's average monthly reimbursement per patient being $200. There is zero cost to patients. InstaMD will benefit your practice. We have FDA-approved devices that seamlessly connect patients to the practice. Many other features including automation, billing, reporting, and analytics. This simply makes InstaMD the best choice. Do try InstaMD today.
Well, thank you, Yukini. For final words as we get ready for Ms. Ager, Dr. Neighbor-Stevens and Dr. Walks.
Thank you, Dr. Maxey. Be watchful, be careful, and practice the safety measures that we have been talking about for months. If you have not been vaccinated, we ask that you seriously consider it. And if you have questions about the vaccine that we haven't addressed for you, feel free to send us an email to Black Health Trust, and we will get that information to you. We want to do whatever we can to help you make the right decision for you.
Dr. Walks?
My main focus today is helping us to get good information. It is so important to take a moment when something is sent to you and just type it into your search engine, look it up, and read the things that come back to you from what we would consider trusted sources. It's not enough that somebody sent you something and that should impact how you behave. These are very serious times. There are a lot of things that are out there, not just COVID-19, and we need to make sure that the information we're getting is from trusted sources.
Well, thank you very much. I'd like to thank Yukini Stevens, our virtual assistant, Mr. Simon Cooper, our production person, and my two co-moderators. I want to make sure that our medical advisory committee knows that we're going to have a major meeting this Wednesday at 5:30. And we're going to have as one of our guest speakers, Dr. Kamal Kokai, who hails from both New York and Los Angeles. He was introduced to me by Dr. Siraj, and he's going to speak to us about his thoughts about treating COVID and other things. In addition, we're going to speak about a couple of other topics and ask our medical advisory committee some of their opinions. So thank you so much. Have a good day.
Bye, everyone.
Brenda Lee Ager.
We need to get Ms. Ager unmuted. There we go.
So I just like to say, this is a song that I'm going to sing. It's a song about meditation and going within. And I think that one of the biggest things that we can do for ourselves is just kind of go in and spend some time with ourselves and the truth about who we are and what we know. And that is the way in. The way in sometimes is the way out. I come to the garden alone while the dew is still on the roses, and the voice I hear falling on my ear, the love said. And God walks with me, talks with me, tells me I am his own, and the joy we share as we're waiting there, none other has ever known. All the secrets that lie within.
Thank you so much, Ms. Hager. Have a good day, everybody.